So thank you very much for joining our webcast. We're sitting in Geneva, Switzerland, at the GAVI Alliance Secretariat. We wanted to make a special effort to reach out to as many African journalists as we could today, and so we asked the African Press Organization to organize this webcast for us. And we also have some European media who have been able to join. So thank you for joining us. I'm joined today on our panel. On my right here is Dr. Kathy Sanger, Health Attaché from the Tanzanian mission here in Geneva. She's a medical doctor and an expert on reproductive and child health. And Tanzania is today receiving approval for both rotavirus and pneumococcal vaccines. So it's very exciting news for her country. On the outside, we have Dr. John Wecker, Director of Vaccine Access and Delivery at PATH. He's been kind enough to stop in here in Geneva. He's a world expert on rotavirus vaccines, and he serves as a member of the Rotavirus Council and works closely with GAVI as a key member of the Accelerated Vaccine Initiative. And last but not least, in the middle we have Seth Berkley, MD. He's an expert on vaccines and immunization, and he's also GAVI Alliance's new Chief Executive Officer. So thank you very much for joining us. And we thought, Seth, we'd like to ask you to make a few remarks, and then one by one we'll go around.
The vaccine preventable disease is still a huge problem in the world. The WHO estimates that one child is dying of a vaccine preventable disease every 20 minutes. And this emphasizes the importance of trying to get vaccines out to the people who need them. And so we're here today to talk about new approved vaccine funding for a record 37 countries, 16 for the rotavirus vaccine and 18 for pneumococcal vaccine. We recently had a funding round for GAVI, which was able to raise an additional $4.3 billion to fund the immunization program from 2011 to 2015. And this is the first of the rollouts commit to the promises that we made to try to get these vaccines out to those who need them. Now, why these particular vaccines and emphasizing them? Diarrhea and pneumonia are the two largest killers of children, accounting for about 35% of child deaths worldwide. Of course, rotavirus is a subset of the causes for diarrhea, but itself represents about 500,000 deaths. And pneumonia, again, a larger cause, pneumococcal, the most important of the causes of pneumonia, and that also is about 500,000 deaths a year. So we're targeting the two largest causes of the two largest killers of children in the developing world. And so what we're talking about today also is the fact that this particularly has importance for Africa. 12 countries in Africa have been approved for rotavirus vaccine. And on Africa, we estimate, or I should say the WHO estimates, that 250,000 children die of rotavirus disease every year. So it's really about half of the world deaths. And one of the things that's important is that we have to think about an equity issue. In the past, the model of vaccines has been they get developed often in the West, they get delivered there, high price, low volume, and it takes 10 or 15 years or longer for those vaccines to trickle down to developing worlds. And so on the rotavirus vaccine, WHO recommended universal introduction about 2 years ago, and Sudan was the first country that received that vaccine in July, and now it's going to get to a dozen other countries. And the goal is to try to get it to 40 countries by 2015, which will immunize approximately 50 million people. If we look at the pneumococcal vaccine side, it's even more striking. Normally, as I said, it's a very long delay between the time a vaccine is produced and it comes out. But the modern generation of pneumococcal vaccines have been introduced now a year after those vaccines were brought into the markets in the West. And so the PCV13, which is One of the 2 vaccines that are approved was brought in Nicaragua, one of the GAVI eligible countries, in the same year it was introduced in the US. So what we're really talking about here is taking the best tools that exist in the world and getting them to children wherever they live. And so the long-term goal, obviously, is to make sure that where you live doesn't matter on whether you're protected with the best that science has to offer. And so we're really excited about this, and for us working in the global health field, this is really something that's going to help us move towards meeting the MDGs, which are obviously coming to a close in the next few years. So the challenge in front of us going forward is going to be how we maintain this momentum, how we roll these out. This is not a simple task. We're going to be working with our partners, UNICEF, WHO, World Bank, PATH, the countries and their leadership, the donors, all to make sure that these countries have the capability to roll these out, cover all of the children in their countries, including children that live in hard-to-reach areas and in subgroups of the population that aren't as well off. But I think, if we look at the partnership that's formed, I think there's no other way to do it than through partnership, and I think this is a very powerful way to make sure we can make a difference in these countries. So I think today we should celebrate this, and I'll be happy to answer questions later. Thank you.
Thank you. Thank you. Dr. John Wecker.
Good morning, everyone, and thank you, Seth, for inviting me to join you on this historic milestone in the rollout of this life-saving vaccine to the children living in Africa. With GAVI's support, I've been working to accelerate access to rotavirus vaccines in GAVI-eligible countries since before these new vaccines were even on the market in the United States and Europe. I've spent the better part of a decade generating and communicating the evidence necessary for policymakers to make informed decisions about the introduction of rotavirus vaccines in the countries where they're needed most. Today, with GAVI's support, 12 African countries will shortly join Sudan, which was the first GAVI-eligible African country to roll out rotavirus vaccines earlier this year. The coming wave of rotavirus vaccine rollouts will provide a lifeline for the children across the African continent. I'm excited and I'm proud to be part of this announcement and to finally see the day when the children who need the vaccines most will have a chance at a healthy and happy life free from the threat of this severe disease. As you heard from Dr. Berkeley, rotavirus is the leading cause of severe diarrhea in children around the world. It kills more than 500,000 children each year under the age of 5 and hospitalizes millions more. In Africa, the statistics are tragic and staggering. Nearly 50% of all rotavirus deaths in the world occur in Africa, where access to treatment for severe rotavirus diarrhea is limited or not available. African children carry one of the heaviest burdens of rotavirus disease. Each year, an estimated 230,000 African children die of rotavirus disease, and roughly 40% of all children hospitalized with severe diarrhea are infected with rotavirus. We know that these vaccines are the best way to protect children in Africa and the rest of the world from severe rotavirus disease and the deadly dehydration that it causes. Numerous scientific studies have shown the swift and significant impact of rotavirus vaccines to reduce child deaths and improve children's health. The evidence that rotavirus vaccines reduce the risk of disease, decrease deaths and hospitalizations, and save healthcare costs is compelling. Countries understand this, which is why we are seeing this tremendous expression of demand for this new rotavirus vaccines. Fortunately, with the success of the funding round earlier this year, GAVI is in the position to satisfy that demand. Last month, I visited Tanzania, including a pediatric ward in Dar es Salaam. The administrator there told me that during the peak of the season, 3 to 4 children fill each one of the beds, many of them suffering from severe diarrhea caused by rotavirus. Everyone in Tanzania is impatiently awaiting the arrival of rotavirus vaccines. Parents, health workers, the Ministry of Health, and most of all, the children. They've heard about the experience in Sudan and have seen the news around the world that vaccines against rotavirus are saving lives in countries where children have access to them. And with today's announcement that Tanzania has been approved to receive financial support from GAVI, the country will begin to put in place the necessary infrastructure and training required to roll out rotavirus vaccines nationwide. I encourage everyone to visit GAVI's website for more information on rotavirus vaccines, and be sure to watch the GAVI film on the introduction of rotavirus vaccines in Africa. The video provides a real-world look at the staggering burden of rotavirus and diarrheal disease in Africa, the high demand for life-saving rotavirus vaccines, and GAVI's commitment to support their introduction in Africa to provide that lifeline for the children across the African continent. The video shares Sudan's experience with vaccine introduction and Tanzania's joyful optimism in the future arrival of rotavirus vaccines. Thank you very much.
Thank you, John. And finally, last but not least, Dr. Kathy Sanga from Tanzania.
Yeah. Good morning, everybody, and I thank you for being part of this panel. As my previous speakers have said, we are very excited to be part of the 24 countries that will receive rotavirus and other vaccines. And Tanzania recognizes that immunization is a long-term health investment and is not a public expenditure. And through immunization services and strong global partner commitments, we believe that we'll be able to reduce child death and reach the Millennium Development Goals. As the previous speakers have highlighted that Africa is the continent which is bearing the burden of the rotavirus burden, we feel that getting these resources and getting support from GAVI will push us further. I'd like to share my personal experience in terms of what the burden is. It's 6 years ago where my young brother's son, who was 10 months old, fell sick. He had fever and he had diarrhea. The parents thought it was malaria. They went to the clinic, they ruled it out that it was not malaria. And then they were asked to continue using oral rehydration therapy, although it is good, but the diarrhea worsened. So they had to rush him to the hospital, where he managed to get emergency care, including IV infusion. He survived. But this case is not to all other children in Africa. So to us, having the rotavirus vaccine being accessible, it's a big excitement. And it's a good intervention that can prevent life for children under 5. So we are very convinced that rotavirus vaccine will reduce hospitalization and hospital attendance, and it has both social and economic impact to the families, communities, and the government. So today's announcement brings hope to many families in our country and Africa in general, and I would like to take this opportunity to thank, on behalf of the millions of children of Africa and their families in other parts of the world, the support the donors and partners provide in introducing these additional new vaccines that will further support the country's commitment to immunization. Thank you very much, and we are looking forward for the discussion which will come forward. Thank you.
Thank you very much, Dr. Sanga. So that's the opening statements. We've posted a press release about today's announcement on our website. It's also been sent to all of you who are watching this webcast in the same manner as the media advisory. And we're here to answer any questions that you have for any of our panelists, so that we can explain the greater ramifications of this announcement today, and what it means, as Dr. Sanga said, for millions of families, children across Africa and other developing countries. There are 37 countries who will be receiving good news today from the GAVI Alliance. And we're excited to hear your questions. So here's the first question from Bloomberg News. If you could go to a wide shot, Gayton. From Bloomberg News, they're saying, can you give us some more information about which brands of vaccines are involved and what price GAVI is buying them? Dr. Berkeley, maybe you could answer that question.
Sure. So on the pneumococcal vaccine, we're getting vaccine from 2 different suppliers. Countries apply for the vaccine that they receive. Those vaccines are a 10-valent and a 13-valent vaccines that are coming from GSK and from Wyeth, the manufacturing companies. The interesting thing about those particular vaccines is that they had been sold at a much, much higher price in Europe and the United States, and a new instrument was created, the Advanced Market Commitment, which was to try to encourage these manufacturers to engage in producing these vaccines in large quantities for use in the developing world. So a target price was set as $3.50. This was a 90% reduction from the price that had been available in the markets in the West. As part of that advanced market commitment, there is additional funding that goes to those companies for making those vaccines available early on. But let me emphasize that that price is a ceiling price, and what we expect over time is that new entrants will come in to the market. We've already got some interest from a number of companies that are in the emerging markets, and those will be expected to enter in the next few years, and we will expect the prices for those vaccines to be dropping. For the rotavirus vaccine, do you want to comment on that?
Go ahead.
There are also 2 vaccines that are currently available right now. Those vaccines are from Merck and from GSK, and we were quite excited to hear a price reduction at the pledging conference on June 13th, where GSK has stepped forward to reduce their price to $5 for their course of vaccines. We, of course, have now, with these announcements, will be going back and doing the procurements of these vaccines, and so pricing will be made available as those come out. But we're excited by the reductions that have already occurred, and obviously we'll continue to try to work on making these vaccines more affordable.
If I
John,
could just add on the rotavirus vaccines, in addition to the 2 products Dr. Berkeley mentioned from the multinational manufacturers, there are several manufacturers in India, China, Brazil, and Indonesia that are also undertaking the development of new rotavirus vaccines, and we expect those to start becoming available around 2015, 2016, and we look forward to a very healthy and competitive marketplace soon for rotavirus vaccines.
Yeah, one other point I would just make on that is that GAVI will only procure vaccines that have WHO pre-qualification. That, in essence, is WHO saying that these meet the quality standards that are necessary. And so one of the delay that Dr. Weckler was talking about is due to the fact that these vaccines will not only have to be made and have to be tested, but then also will have to receive this certification from the WHO.
Thank you. Here's a question which perhaps Dr. Sanger can answer, or start answering. What does this announcement mean for children in Africa?
This announcement means that we are talking about 50% of children who suffer diarrhea will survive. It means survival.
It's extraordinary. And John, you spent some time recently in Africa. What is your take on the introduction?
It's devastating for families. Severe rotavirus, gastroenteritis, diarrhea hits very, very young children, and it's devastating for the families to lose children that young. But we now have the ability to prevent many of those deaths. And I think it's survival, but it's an opportunity for life. It's really an opportunity for a healthy, long, productive life. As many vaccines provide these opportunities to prevent these terrible diseases, rotavirus is a critical tool that we should be adding and using throughout Africa and the rest of the developing world.
And I think one more point to bring up, and Dr. Sanger already mentioned this, but I want to emphasize it, is that it is exactly in the least well-developed, in the hardest, the furthest to reach, the most difficult areas, that in essence this has the most value. Because as you heard, in a setting where you have access to an urban hospital, you have the ability to get intravenous fluids, to get other treatments, and even in that case, not all children will survive. But in areas where you don't have access to those conditions, prevention is always best, but particularly in those areas. So trying to make sure that in those areas you don't get that diarrhea to start with that starts you down that path is the critical thing.
Thank you. Here's a question from afric.com. They're asking, have your vaccines been tested already? Dr. Berkeley, why don't you start?
I think the interesting thing about vaccines in general, but of course these in specific, are that they go through a rigorous process before they get registered in the first time. A research process to start, then very large trials to look at their safety, and then these particular vaccines have been rolled out, as I've said, in the West before they've made it into the developing world. So we have literally millions of patient years of experience with these vaccines, looking at safety in these populations, and there are systems of surveillance to ask the question, once vaccines are out, what side effects do you have, and those are compiled as well. So we have very good information on the safety of these vaccines, and they are extremely safe.
Yeah. So we together with GAVI, with funding from GAVI, conducted large-scale, placebo-controlled, randomized, state-of-the-art clinical trials that unequivocally demonstrated in the poorest countries in Africa and Asia that these rotavirus vaccines have the ability to reduce severe disease. The information collected in these trials was critical for this recommendation Dr. Berkeley referred to earlier by the WHO, this global recommendation that all countries should be introducing rotavirus vaccines around the world. Once countries introduce rotavirus vaccines, we continue to conduct studies to look at the real-world impact after their introduction. Again, with the funding support from GAVI, we have conducted these effectiveness studies, these real-world studies in countries in Latin America, including Nicaragua and El Salvador, to show clearly the reduction of disease that occurs after you introduce the rotavirus vaccines. In addition, we have ongoing effectiveness studies in South Africa as well as Bangladesh to continue to show the world that these vaccines have an important role to play in increasing child survival and reducing deaths due to rotavirus.
Thank you. Thank you. It's a very good answer. Dr. Sanger, maybe you could just talk a little bit about the families and communities' willingness to participate in immunization for their children. I mean, you've many experience, years of experience working in Tanzania. How do communities, react to the availability of these childhood immunizations?
As I mentioned earlier, that immunization is a priority in our government, and we have been conducting immunization programs for the past 30 years, and communities have seen the value of vaccination, especially when we talk about measles, polio, diphtheria, and other conditions. So the community has trust a lot on vaccine, and they have seen the benefit. So to us, when we introduce new vaccines like this rotavirus, when we educate, we inform the benefits and the value of it, they really come forward for that. And as I said, we are also facing other challenges in the system. When you talk of the human resource, we are facing that challenge where now, if we cannot prevent, it will be very difficult to assist someone when he or she falls sick. And to us, prevention is a priority. And to us, we see that there is a need really, as we have committed to fence immunization funds. So even when you look at how our government is operating, immunization funds is fenced. We have been co-financing the support which we are getting from GAVI, and the commitment is there. So for families, they will come forward for that because there is a cost besides just admission, but the other costs which can be reduced once we prevent these diseases.
Thank you.
To Dr. Sanger's point, we're also, as part of this announcement, 4 countries are going to receive financing for meningitis vaccine, meningitis. And that vaccine is relatively new, being rolled out across the meningitis belt. And there's another example of a very fearful disease that occurred in epidemics across the belt in Africa. And, it disrupted the economies of those places, had enormous effects. These have just begun to be rolled out over the last short period of time, and we've seen dramatic effects. First of all, disease has disappeared in some of these places that have regularly been living with this, but also, to the point Dr. Sanger made, the demand for these vaccines, because people see this disease, is absolutely critical. So we're delighted to be doing that, but it does go back to the point that as vaccines succeed, we have a paradox, a problem, because the demand when people know about the disease is enormous. As people get used to being vaccinated, the disease disappears. There's less understanding and less desire to get it. So this is one of the challenges we have in working with vaccines.
Thank you. Here's another question. What is this worth in terms of money? How much is the total cost of the approvals today?
So the approvals today were a little over $1 billion in resources that are spread out across these vaccines.
Thank you. Another question from DPA, Deutsche Press Agency. They're asking about the annex here, and they're asking about the other vaccines. So I guess this is pentavalent measles second dose and meningitis A. You've mentioned meningitis. Maybe you can talk a little bit about these other vaccines that we're announcing today. Dr.
So I'll just say that pentavalent vaccine is a combination of 5 different vaccines. So it's the diphtheria, pertussis, and tetanus, Haemophilus influenza type B, and hepatitis B. And the advantage of putting those all together means less injections, ease of handling, and it's been rolled out now in many countries across the world, and this has been a really exciting intervention. Obviously here, 2 of the countries that are being discussed, Nigeria, a very large country that has a very important role to play in terms of number of children, the largest number of children unimmunized on the African continent now, and Somalia, which of course has its own issues given the fragile nature of that state. So we're quite excited about moving it out there. On measles has been a component of vaccines for a very long time, but we're in a quite different state now, which is we're trying to really eliminate measles as much as possible from many different parts of the world. And we've already seen measles elimination occur in the Americas, in Europe, and although there have been some cases that have been re-imported, and the idea over time is to try to really get the level of immunization coverage up, not just by routine immunization, but by providing second doses and then also campaigns. And so this is about giving a second dose to make sure we have very good coverage, and I've already talked about the meningitis.
Thank you. Here's a question from Bloomberg News. Do you have 2 questions? Do you have a ballpark estimate of how many deaths these announcements will prevent? And secondly, can you explain the mechanics of the program? Does GAVI purchase and distribute the vaccines on its own? Dr. Berkeley, why don't you start off and then we'll move on.
In terms of the mechanics of the program, the way this process works is countries put in an application for the particular vaccines they want. These vaccines are then reviewed by an independent review committee that looks at the capabilities of these countries to be able to deliver the vaccines, the storage facilities, the so-called cold chain, where these vaccines need to be stored. Is it adequate to take these new vaccines forward? Does it reach down to the rural areas? Based upon all of that, they make a set of recommendations that says, yes, we think they're ready to go, or we think they're ready to go with some minor changes and modifications, or they need some major work. Based upon that, then, they get approved, and that's what we're talking about here, is the approval of these countries. And with that approval, then a process will go forward to procure vaccine for them, to get it into those countries, and then those vaccines will be delivered by the countries and their own immunization programs, working with our partners on the ground.
Dr. Wecker, maybe you can talk about.
Yeah, I would just add, Dan. So first of all, there was a very important set of results that just came from Mexico that demonstrated unequivocally that the use of rotavirus vaccines reduced mortality. They saved lives. Now, how many lives we're talking about depends on a number of factors. And clearly one of the more critical factors is the number of children who we can reach, or the coverage levels. As we roll these vaccines out in Africa, as you heard earlier, there are challenges distributing these vaccines to all parts of the country so that all children have an equitable access to the vaccines. So in addition to the investments that we make in developing the vaccines and distributing them, we also need to make investments in the healthcare systems to make sure that we're able to reach all the children. If we can reach as many children as possible, the number of lives saved will go up.
Thank you. And Dr. Sanger, maybe you can talk a little bit about how the Ministries of Health, our partners on the ground, together with support from UNICEF and the World Health Organization, how they receive the vaccines and then roll them out to communities across all the regions in the country.
Okay, thank you. As I said earlier, first, one of the key activity which we normally do is to do a lot of advocacy and information sharing to the general population, to the service providers. And then we do have our procurement and distribution system where partners do support us in procuring and also support us in the storage capacity. And we also look at the outreach services where community-based service providers are also used to send information and also participate in some of the activities of immunization, especially for those types of vaccines where you can provide it by orally. There's a lot of training which goes on to the service providers, the storage capacity at central and district levels, and also at facilities where, again, because of the new additional vaccines, there are some additional requests which we normally asked to assist us to expand storage capacity, and then the government takes up on that.
Thank you, thank you. Here's a question, Dr. Wecker, about rotavirus vaccine. When will the rollout sort of begin, particularly in Africa? And what will it mean for Africa, the rollout of the rotavirus vaccine?
Well, the rollout, as I like to say, it's a lifeline for the children in the African continent. We saw the first introduction in an African GAVI eligible country in Sudan in July of this year. A very exciting introduction, and one that we've heard went flawlessly. The coverage rates are already quite high. There's an excitement throughout all of Sudan to have access to this new vaccine. As we heard today, 12 additional countries in Africa, 16 total, but 12 in Africa, now have the opportunity to also introduce this new vaccine. We expect several of these countries to begin early in 2012, and then several others will begin in 2013. The reason that it takes some time, as we've just talked about, countries need to put in place the necessary infrastructure. They need to build out the cold chain capacity to accommodate new vaccines. They need to train healthcare workers. They have to educate communities to make sure the communities understand the benefits. And so for some countries, it takes a little time to put all that in place. So we'll see a wave of introductions in the next 2 years, and we fully expect that in the future, many more African countries will be applying to GAVI for support. And again, with the goal of over 40 countries worldwide introducing, GAVI-eligible countries, introducing rotavirus vaccines by 2015.
Thank you, thank you. Here's a question from Development Today. How is it decided whether countries receive the 13 or 10-valent pneumococcal vaccine? How many countries will be receiving 13 and 10? Dr. Berkeley.
So we allow countries to apply for which particular products they want. Now, from an epidemiologic point of view, these vaccines are quite similar, and so we don't see them as, in these particular populations, as having a dramatically different coverage. One of the complexities of the pneumococcal disease is that there are 80 different serotypes of pneumococcus, and the original vaccine was a 7-valent, and it left out a couple of the strains that were more common in the developing world. So it was designed particularly for the West. These new vaccines both have strains 1 and 5, which are common in the developing world, and so in essence they're interchangeable. They have slightly different packaging. One is a 2-dose packaging and one is a single-dose packaging. And up until now, we've been able to try to get countries what they choose in terms of these, but we also obviously have to look at issues of the supply for these vaccines. These are very, very complex vaccines to make because of all the different subtypes in them, because of the conjugation process, And as a result, we hope to continue to provide them as countries ask for them, but it may be at a certain time we'll have to substitute one for the other based upon availability of supply. And obviously, we're working very closely with our manufacturers to make sure that there's an ample supply. One of the advantages of this type of pooled procurement and something like the advanced market commitment is that we can work with the manufacturers and give them demand forecast going out that allows them to make plans, scale up their facilities and work, which has a couple of year lead time into doing that.
Thank you. A question from The Guardian in the United Kingdom. We've slightly addressed, but we'll ask it again. When do you roll out these vaccines and which countries get them first?
So the two issues is going to be when they apply for them, and obviously those that are approved will go before those that don't. But then, as Dr. Weckler has said, it's really based upon the capabilities that are available in those countries. How ready are they for doing this? And then they have to put a plan together to roll them out. And so a lot of that will depend upon what's going on locally with the countries.
Correct.
Thank you. A question from Africa 24 television. They're asking, can every family afford these vaccines for their children? Dr. Berkeley.
The long-term hope from GAVI is that there will be sustainability of these vaccines as countries' economies grow, and over time there is co-financing of these vaccines that they move forward. But we understand that in very poor places in countries and regions, there may not be adequate finance to roll these out initially. And so what GAVI is doing is using donors of finance to bring these vaccines to the countries. Now, in the countries we're talking about here, these vaccines are not charged for. These are being given by the governments as part of their immunization programs. Of course, in some countries, vaccines are available on the open market, but in this case, we're talking about ones that are being publicly provided. Over time, we also hope that working with manufacturers, with the healthy market that Dr. Wecker talked about, that we will be able to reduce these prices further. Although for us, it's not only important to reduce prices, it's important that we have a stable and healthy vaccine market that includes supply security. So ideally, we'd like to have multiple different vaccine producers for all these, because given the complexity of production, occasionally you do end up with problems in producing them, and we don't want to have run out of vaccines in those circumstances.
Thank you. Dr. Sanger, how do families, in Tanzania, how do they come to this question? Can they afford these vaccines?
Okay, thank you very much. As we had said that the government has seen the value of immunization, and to us there is a policy since independence that health for children under 5 is free. So with that policy, it means government is taking care of all the under 5 cases. This includes immunization. And to put it in practical terms is that there's funds set aside to procure vaccines. The initial support which we get in terms of the requirement for the GAVI vaccine initiative, where they ask for co-financing. Since we start working with GAVI in 2001, we have been able to fulfill the requirement of co-financing, and we continue to provide the vaccines free. So what we are working on is now to make sure that they are accessible to every community. And the approaches which we use is both using clinics but also community-based interventions. And we normally have community-based days. And we also use some of the events which occur in the year, like the African Child Day, which occurs in June, and also in December, where we link it with other interventions, also to bring up that to be able to reach other children who could not be reached during routine processes.
Thank you. So that's very clear that the vaccines are free at the point of use, free to families who want to bring their children for immunization. Here's a question from Africa Science News Service. They're asking, what is the procedure for application, and won't it derail the urgency of giving vaccines to the children? Dr. Berkeley.
Again, to emphasize, I started, the first thing I said was about the urgency of one child dying of vaccine-preventable diseases every 20 minutes. And so that is, exactly what we have to live by. That being said, we also have to make sure that the delivery of vaccines is done well and that the vaccines are handled properly. These are absolutely critical because we're dealing with healthy people, and we want to make sure there's confidence in the system and confidence that once the country decides it's going to move forward, that there's an adequate supply of vaccines, that vaccine can get down to all the parts of the countries who need it. So that requires planning. So it's a combination of urgency, you'd like to do it immediately with enough planning to make sure that when the rollout occurs, it occurs in a way that instills confidence in the families. We know in the past people have walked, gone, hours and hours walking to faraway clinics only to find out, in fact, that vaccines weren't available, and that's exactly the type of thing we want to avoid. So it's that combination, but obviously we're trying to move it as quickly as possible.
Yeah, thank you very much. So we're still open for questions. We have about 10 minutes to go. If anyone has a question. Please, we'd love to answer your questions. Here's one from Bloomberg News asking, just to confirm, is the negotiated price 90% less than the Western price for all the vaccines involved? You mentioned the pneumococcal vaccine, Dr. Berkeley.
That is on the pneumococcal vaccine. On other vaccines, there are differences, and obviously it depends upon the price. When vaccines first appear, they come in at quite high levels, and they do drop down over time, even in the West. And so this is a moving target, and it depends upon the comparisons, at any point in time. But the goal here is to try to have them available at the least possible price while keeping a healthy vaccine market, and that's the one we're going to continue to drive towards.
Thank you. And just to add to that, the cost of the pneumococcal vaccine for one shot in the United States is about $93 a dose, and we're procuring it for $3.50. So that shows it's a more than 90% decrease. It's a very, very large decrease in that case. Another question from Afric.com. They're asking, do the vaccines just have to be administered one time? Can the sickness come again? Let's start on rotavirus. Dr. John Wecker.
So for rotavirus, there are two vaccines available. One is administered in a 2-dose schedule, and one is administered in a 3-dose schedule. These are given at the same time that the child receives their routine immunization, the pentavalent vaccine. So it's just a matter of adding a few drops of this new vaccine when a child comes in for the normal immunization schedule. That will provide protection for that child during the most vulnerable period, during those early years when that child is most vulnerable to severe rotavirus disease, which is our objective, is to prevent that first early serious event. And after that, the child will grow and mature. And rotavirus is something that we all live with. It's part of the environment here, so we're constantly exposed. But if we can protect that child from that first serious case, then that child has an opportunity to live a long and healthy life.
And I think for pneumococcal vaccine, it's a similar story. 3-dose vaccine, again given at routine times. And what we know is that protects during the childhood period to the strains that are in those vaccines. As I said, it doesn't cover every pneumococcal strain, but it now covers most of them, at least 80% of the potential disease. It may be that over time those wane, but given the fact that this is where the real disease burden is, where the severe disease is seen, it protects against the childhood disease that we're most worried about.
Thank you. And Dr. Wecker, maybe you can expand a little bit on the idea of protection. So the child is protected, but I believe that other members of the family are also protected from the child being immunized.
Yes, the youngest children, as I said, are the most vulnerable to this severe rotavirus disease. And we've seen in clinical trials that providing the vaccine prevents these severe events. What we're also beginning to see, and this is some very, very interesting results coming out of the United States as well as some other places, that children, older children who were too old to receive the vaccine, we're also seeing a reduction in disease in those children as well. So we're getting what we call the so-called herd effect. The fact that you, first of all, the youngest children are the children that are infecting others in the community. So if we can prevent that occurrence, then we block transmission. And as well, that just reduces the total amount of disease in a community. So an entire community actually receives protection just from immunizing that one child. So we get a benefit that goes well beyond just vaccinating that one child.
Thank you. Thank you. And here's a question from Development Today again. They're asking, Seth, you said that the total investment in approvals is about $1 billion. How much is the recipient country's contribution to this total figure in terms of co-financing, I guess?
I don't have that number on the tip of my fingers, but for the poorest countries, they're co-financing at a rate of about 20 cents per dose of vaccine. So we'd have to calculate out the numbers of doses that are associated with that. And then as countries get higher economies and go closer to graduation levels from GAVI, then the rates of co-finance goes up. That number I mentioned is not including the country's contribution. That is excluding it. This is the contribution that GAVI is putting in as part of the co-financing.
And Dr. Sang has talked about Tanzania's co-financing of the vaccine. What is the principle behind this idea of co-financing? What is GAVI trying to do by insisting that the recipient countries pay a small portion of the cost of the vaccines?
Well, at the end of the day, one of the most important things, vaccines are unarguably the most cost-effective intervention you can have for healthcare and preventing disease. And so one of the issues is that all countries should prioritize this as an important tool that they should be using in their countries. And to make it sustainable over time, it is important that countries have that discussion. And it isn't the ministries of health. Dr. Sang has already talked about how ministries of health understand that completely. It's getting ministers of finance and political leaders to understand the importance of this. And so by having a co-financing program from the beginning, people begin to create a line item for vaccines. They begin to prioritize when they have discussions about health interventions. They talk about the cost effectiveness of these. And then over time, they can move to a state where they'll be able to support these. And one of the issues that's important to say is that these newer vaccines are much more complicated than the ones that have been used in traditional vaccine programs. The EPI vaccine, the standard 6 antigens that have been used for years, the 6 of them together cost less than $1. And we've heard pricings here of multiple dollars for vaccines. And so it would have been a very big jump for countries that were already procuring their vaccines to take on these new vaccines. And so that's what this program of GAVI's co-financing is trying to do, is help them during this period until their economies get stronger, until vaccine prices come down and they can afford the full cost of them.
Thank you. And I think we've got time for one more question from Bloomberg News. They're asking about how does the size of this particular commitment compare with previous programs? And is this the largest ever purchase of vaccines for developing nations? So it's a good question. Dr. Berkeley.
Well, this is certainly the largest rollout that GAVI has done in terms of both the demand, and it's been quite interesting, as Dr. Wecker has said, as people have begun to hear about these vaccines, understand the disease, the importance of the diseases they target, and see the effect in other countries. This particular round to GAVI, we had 74 applications from 50 countries. And so, this is a massive interest. And in this case, we've talked about the 37 programs that are being moved forward here. It is, for us, I believe, the largest commitment of funds that have occurred. It's hard to say in the history of things going on that this is the largest, but I think in our history it is.
Terrific. Well, if that was our last question, so thank you very much indeed. We've had a tremendous response from people wanting to join this webcast. Thank you, all of you who have joined us for this media briefing. including some people in the United States who have got up very early in the morning to take part. The press release is out now. The embargo has lifted. It's on our website, www.gavialliance.org. You've seen that on the screen. There's a whole host of materials on our website, including a film which Dr. Wecker mentioned. So from Geneva, we'd like to thank you for joining us. And if you have any more questions, there are media contacts on the screen that you can see now. We'd be happy to follow up and arrange interviews and answer your questions today. Thank you very much indeed.
Thank you.
Thank you very much.
Thank you.
That was great.